Whitney, go ahead.
Hi, everybody. Good afternoon and welcome. Thank you for joining us for today's Great Challenges live event, part of the Great Challenges program, sponsored by the Robert Johnson Foundation. I'm Whitney Zatzkin, part of the team at TEDMED, and I'm here to moderate the discussion for today, which will run about an hour. The goal of the Great Challenges program is to look at the most complex problems in health and medicine, issues that can't be solved with a magic bullet. Today, we will explore the technology helping to build transparency around healthcare costs. We will take your questions on social media. Just make sure you take your questions with #GreatChallenges, and we'll answer absolutely as many as we can today. Allow me to introduce our participants for today. Jeannie Pinder is the founder of Clear Health Costs, a Great Challenges team member. Jeannie partnered with WNYC recently to crowdsource the cost of mammograms. Welcome, Jeannie. Lisa Mackey is the founder of PocketDoc, an online marketplace aimed at starting healthcare cost details, and one of the 50 startups featured in the Hive at TEDMED. Amy Edgar is the founder of the Children's Integrated Center for Success and an assistant professor of nursing at Cedar Crest College, one of the sites participating in Great Challenges Day Live, part of TEDMED 2013. And finally, we have Mary Beth Shannon and Jen Joint joining us from the California Healthcare Foundation. They just co-authored a piece on cost transparency in hospitals titled "No Method to the Madness" in this week's Health Affairs. Appropriately titled piece, guys. In your Health Affairs article, you actually describe some of those weird things that happen when hospitals send out their bills to health insurance companies. At one point, you even highlight that 2011 data from California that shows that hospitals were paid an average of just 25% compared to what they billed. Could you provide us with some of the other highlights from that report, Mary Beth?
Actually, I think Jen's going to take this.
Oh, great.
Go ahead, Jen.
Okay. Yeah, I would say for us, the biggest highlight and why we even kind of wrote the piece is there's a lot of attention around the Medicare reporting of prices from hospitals. And what struck us was there's just a lot of media attention to this, but these aren't real prices. These were charges being reported. And the transparency effort to help consumers is really only going to work if you can actually get real price information out there, not just charges. And so that was one big focus of our piece, and I guess the other one was to look at this big difference between actual charges and what a hospital gets paid. So as you mentioned, Whitney, this big discrepancy between what Medicare is paying someone and what a hospital is actually quote-unquote charging Medicare. So we tried to explore why is that gap so big. And then our real call was maybe it's time for the charge system to really be reformed, and maybe just let's focus on what a real price is, what real hospital prices are, and let's try to get that information out to the consumers of healthcare.
Great, thank you, Jen. So, Amy, you're joining us, and you're actually a practicing nurse and a nurse faculty member at Cedar Crest. When you hear about a hospital being paid 25% of the original amount billed, and the idea that Jen just mentioned of just completely reforming everything, you must absolutely leap to that place where you wonder about the patients in your practice. Describe to us how some of those conversations around cost issues typically unfold.
Well, you're correct on all fronts. It's confusing. My patients have a really difficult time making sense of the pricing, the reimbursements, what they're responsible for in the long run. So I am so excited that we're tackling this and looking to change. I'm for changing it all. The conversations that we have personally really kind of fall out in 3 different areas. So the first one is, I call it kind of the sticker shock conversation. So when a patient says, you know, so I need this service, what does it cost? And I tell them the real cost of the service. Often it's significantly greater than what they're used to paying with a copay. So they have no idea what the true cost of the service is. So there's that kind of sticker shock moment. And really the comment there is, gosh, I've just never really thought about this before. And so there's an opportunity there to engage and educate around cost and value. Kind of the second place it falls out is patients often ask, well, I have these resources, if these are the costs, you know, and these are my needs, what do I do about that? And so it's kind of like putting a puzzle together with a patient. And, you know, that's very resource and labor intensive from my practice side. We spend a lot of time talking to people and helping them put those pieces together. And I feel very lucky that we can do that. I'm sure there's lots of places that can't and don't. And then kind of the last part of the kind of conversation that we have is, okay, if these are the costs and these are your resources, is there a way to finance or payment plan or subscription service, something? There's kind of different models for that floating around right now. And those conversations are also, you know, lengthy, involved, require a lot of education and time, you know, over time, not just one conversation, it's usually many.
Great, thank you so much. It's I think across this entire conversation today, we need to keep in mind exactly how all of this translates to the patient. Mm-hmm. So now we're going to dive right in. Jeannie and Lisa, you guys are both working very hard to grow the transparency around healthcare costs through technology in order to save us all, you know, within the healthcare system, since it does seem to function without any sort of direction when it comes to healthcare costs. Jeannie, let's start with you. Clear Health Costs actually issued a call to patients recently to go through and actually share the costs of services surrounding all of their procedures and things. I know in particular you worked on mammograms just recently over the summer. Could you talk to us about that effort and some of the other issues that you guys have been addressing?
Yeah, thanks so much. So we've done a couple things here at Clear Health Costs. We have a pricing survey mechanism. We're journalists, so we've developed a pricing survey. We call providers and ask them for their cash or self-pay prices. We're now in 7 cities with a range of 30 to 35 what we call shoppable procedures. We're not trying to price out your emergency appendectomy, but your MRI, yeah, we'll tell you a